All right, well, Zandria, I appreciate you being here with me. My understanding is that you've got some tension in your lower back. Is that correct?
Yes.
What I propose that we do is this. I'm going to do some soft tissue to your back, okay? The reason why I'm doing is I want to bring that pain down. What you should know is when I perform soft tissue, like when I'm doing some of these to your muscles, a few things go on, okay? It's not as simple as to say we're making the muscle longer. What you should know is that there's a few things that occur. First thing, the way you're going to experience is that the reason why you're so tightened through here likely is that your nerves are really active. And what's been demonstrated is that when I do soft tissue, we get those nerves to calm down a little bit, which should, for you, equate to you having a little bit looser muscles of your back. That's the first thing. The second thing that occurs is this, is that there's changes that occur in the spinal cord, okay? What occurs is this, when I do soft tissue, your spinal cord sensitivity actually turns down a little bit. So things that would have sent pain fibers to your brain no longer send pain fibers. So my suspicion is that you'll feel a little better going forward. The final thing to know, if that wasn't enough, is that you've got things going on in your brain. When I do soft tissue mobilizations, there's a whole chemical cascade that occurs within the brain. A bunch of inhibitory turning off of the pain stuff within the brain. So though you're not going to be able to sense it, what you will know is that there's actually a lot of chemicals, changes occurring within the brain. They're going to equate to you feeling a little bit better, okay? At the end of all that, I'm going to show you how to work on your own back, all right?
Sounds good.
Is it all right, Zandria, if I get you to go face down for me?
Yes.
That's it. I'm going to have you go face down. This will be for your belly, and you'll be right here.
Okay.
Now, Zandria, do you have any issue with the use of cocoa butter on your back?
No.
Okay, and I'm going to have you go more along your belly, okay? Just like this. Perfect. Great. Is it all right if I expose your lower back?
Yes.
Okay, perfect. Just like this. Okay? Now, what I'm going to do, Zandria, is I'm going to drape you appropriately. And what that means is this. I'm going to take a towel here, and I'm going to put a towel on your pants, okay?
Okay.
Just to prevent your pants from getting anything. And I'm going to do the same thing for your upper body, okay? Just like this. Okay. Now, Zandria, what I'm going to do is I'm going to perform a couple different techniques. The first technique is going to go along the grain of the muscles. Zandria, do you know how when you're looking at a piece of meat, there's fibers, there's an orientation to the fibers of your muscles? Are you familiar with this, Zandria?
Yes.
Okay, the first thing I'm going to do is I'm going to go along the orientation of the fibers.
Okay.
That's a little softer. And the second thing I'm going to do is I'm going to go cross fiber. And I'll explain that here in just a moment. Okay. So what I'm doing now is I'm going to apply some of that cocoa butter to my hands, just like this. And I'm going to apply this to your back. Okay, perfect. Just like this. Good. Okay, great. Now what I'm going to do is I'm going to stand at the head of the table. Okay. I'm using my thumbs here just like this. So what I'm going to do is I'm going to apply pressure here. Are you okay with that pressure there, Zandria?
Yeah.
Okay. And I'm going to apply this mobilization right here. Perfect. And with this sustained pressure, we're getting alteration in your nerves. So your nerves are going to change in how readily they fire. The result of that is you're expected to feel some relaxation with this afterwards and get an improvement in how tight these muscles are. Sometimes these muscles can get really on, and when they don't turn off, that can cause people some issue. Are you okay with that pressure?
Yeah.
Good. Okay, so this is with fiber just like this. That's perfect. If that's tolerable, then we move on to cross fiber. So now with the cross fiber, what you want to do is this. Get this back open, okay? Take your thumbs here. Find the muscle belly just like this. You can see how our muscles are popping up. What you're going to do is you're going to provide a cross fiber just like that. Good. Zandra, are you tolerating this okay?
Yeah.
Beautiful. Just like this. Nice. You can pin it and you can use your palm and slide across. Good. You're always checking in with the patient. That's not too intense, is it, Zandria?
No.
Good. You're doing great. Beautiful. Do one more just like this. And that's perfect. Good. Okay. Now, Zandria, what I'm going to do is this. I'm going to wipe you off. I'm going to have you stand up for me. That's it. Good. Nice. Now, Zandria, what I want you to do is this. Go ahead and stand right here. Do a forward bend for me again. Does that feel the same, or does that feel better than it did?
It feels better.
It does feel better. Okay, great. Now what I want to do is this, Andrea. I'm going to show you how to work on your own back, okay? Andrea, what I want you to do is this. I want you to take a lacrosse ball, and I want you to put a lacrosse ball right on that muscle that we're talking about, okay? So if you imagine that you've got two big muscles that run down the sides of the spine. For you, we just got done working on this right one.
Mm-hmm.
So what I'm going to have you do is this. Take a lacrosse ball. Put the lacrosse ball right on the spot that's giving you your bother.
Mm-hmm.
And do you remember how we went up and down first?
Yep.
That's what I want you to do. So you're going to take this lacrosse ball, applying pressure as much as is tolerable, okay? What I want you to do is slowly work up and down the side of your back.
Okay.
Let's have you do that for a couple minutes, and then what I'll have you do is I'll have you go side to side with it, just like that, okay? Andrea, show me what that looks like.
So, the middle of the muscle.
Mm-hmm. That's perfect.
And go up
And
and
go
down.
Up and down, excellent, that's great. And then side to side. Yeah, perfect, just like that. Good. Any questions about what we did, Zandria? Or
No,
how
I
all
think
these
that
things?
was pretty good.
You did really good. Zandria is awesome. Okay, well, thank you guys. Appreciate you.